today's scenario, starting a hospital is very difficult. We're going to find out whether it is worth or not. If it is worth, how we can run successfully. If it is not, we're going to find out. To find out, we have a special speaker today who is coming from the best hospital in Tamil Nadu and best in Coimbatore. And yes, that is PSG Super Specialty Hospital. Dr. J.S. Bhuvaneswaran. He started Ahalia from zero today, 2,000 a day. So what are the ethical ways you can suggest? What are the key challenges managing hospitals today?
The core manpower in any hospital is medical and nursing.
And what makes you turn into administrator?
You know that historically PSG was started as a medical college. PSG has already completed 22 heart transplants the last 2 years.
What are the new things changed after COVID?
Hospitals should be able to spend money on these things.
So what are the 3 advice you will give to the new hospital owners who want to start?
Now, as I told you, the most important thing is first, nobody starts hospital once they finish their job. Many a times, there are, I call it a family business. There are doctors, children who pass out. When they pass out, they naturally go back to their father's setup, and that itself is only 50% now. 50% of the doctors' children, even if they are doctors, they do not want to go back to their setup. They want to go out and practice. Keeping all this in mind, if you are going back to your parents' practice, you have to be very clear. You may want to start something new. So you have to do a thorough brainstorming, because for you to start a hospital, the most important thing what you require is an infrastructure. The infrastructure means nowadays the infrastructure of the building, the infrastructure of the land, the cost, building cost, equipments, etc., are humongous. So, again, honestly speaking, you should do a market survey. You should see where do you stand, what is lacking in that area, what can be, how can you make a difference in that. So, you have to do now, starting a hospital has to go by a proper pre-hospital planning.
Yes.
By which I mean you should know, if I start a hospital of this volume, this size here, with this speciality, this would be what I can expect. So this is very, very important. So you have to plan your finance very, very well. So how much I have to go for and how fast I can complete. So now actually there are so-called the prefab constructions have come, in which you can cut the time so that you don't keep on building over months and years. So second, having planned this, you have to again do homework of what is going to be my resources. Because again I am telling you, the core business, the core activity in hospital is delivering health care. So that depends on doctors. So people come to hospital only for doctors. That means who are the doctors? Who are all going to be the doctors? What are their strengths? What are their prices? How much you have to pay? Is it going to be only your own family? If it is so, how do I run it without having a misunderstanding between two brothers starting something, or brother and brother-in-law starting everything? You have to make sure what should be his share or what should be her share, my share, our share. All this have to be worked out. So human resources, especially the doctors. Having got these two, the next important thing is who are all going to be my supporting people. You have to really should have, in fact I remember, I'm not telling it as a joke, in fact when I came back from Abu Dhabi, when I saw, we did not have actually a department of operations in our hospital. I'm not telling it as mistake, because we were traditionally running it with our nursing head and administrative head and our PROs. They were actually the people who were sort of doing things for the hospital.
Multiple work.
Yes. So, in that way, I created a department of operations. I made sure that there are operation managers who will take care of the patient flow, who will take care of the processing. All these things we started, we brought in the culture. That way, You have to decide, as I told you, you have to make sure that you have a good finance person to support, you have a good manager to support your general administration, you have to have a good quality experts and accreditation experts, you have compliance experts. That means even for a small setup, you need experts for a larger institution or a person with multiple expertise in a smaller institution. But you cannot overlook any area. Every area has to be taken care. And never forget that how are you going to market your facility? How are you going in a ethical way? Because now the practices, there are so many practices. I don't think that any of these wrong practices will sustain.
Yes.
If you have to stay in the market, you have to really be very, 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 very ethical, because ethics only will finally stand. Unethical practices can go somewhere here and there, but that cannot win you on the long run. So you have to make sure that this. So that means infrastructure planning, pre-planning, infrastructure planning, pre-planning through market research, then infrastructure planning, financial planning, resources planning, and then you have to work in a smart way. The smart way of working means patient's delight, patient's experience. If you have to give, you have to make sure that it should be taken care. It has to be very, very well promoted digitally, because times are gone in which people go for advertisements in paper. Yes. Nothing will work.
Yes.
It is digital,
Yes.
and it's an investment. If you have to have good people, you have to pay a decent salary. You have to pay a decent salary, only good, affordable people will come. Then you should make sure that they are retained well. So let me tell you, dear, it is somebody who wants to venture into starting. Clinic starting is possible. Clinic starting is can be done as a trial, like a beta run, I would say. Starting a hospital, doing a hospital as a fresh, it needs a lot of planning. I would say needs a lot of courage to do it. So attaching yourself with an institution, having a clinic practice is the safest, which I think now many of the smart people have started doing as alone or coupled. They are working in a hospital, they have their clinics, and they make a decent money, comfortable, peaceful mind, and live. But there are very successful entrepreneurs who start set up. I told you the Avanashi setup. I was so proud to see that he has got the latest of cath lab now, and he said, "Sir, I need a cardiologist." See, he is a neurosurgeon who started the hospital. Now he is making it a multi-specialty. So that way, now so much of advances are possible, provided smart working, hard working, and intelligent working people.
Thank you, sir. One final last question. And you said when you start with Ahalya, it was 2 patients a day to 2,000 patients a day. What are the strategies you incorporated so that the patient flow increased? So with that, we want to conclude.
See, Ahalya, even PSG, to be very honest, when I came back from Abu Dhabi, PSG as a single hospital, we had a hospital which was catering to the medical college patients and the paying so-called specialty patients in the same building.
Yeah.
So we were receiving around 750 to 1,000 patients a day.
Yeah.
This was in 2019.
Yeah.
In 2024, currently we have 2 hospitals, one exclusive medical college hospital and one exclusive super specialty hospital, in which now we are now on a busy day, we see any day, anytime we see around 2,200 patients. It's doubled. So it is not that when we divided the hospitals, the hospital forces, it halved, it doubled over 1 year, over 3-4 years. Now, how it is possible, how we can do it? Same way in Ahalya started with 2 patients a day, and now when I left it was around 1,000 patients, not 2,000, 1,000 patients a day. How it was possible? It was possible primarily because we focused on the following. Number one, we made sure that the patients come to hospital only for the health care.
Yeah.
Nobody comes to the hospital to just see around.
Yeah.
So we made sure that the patients flow. They start with entering the campus, to registration, to sitting in the OPD, to going for investigations, going to the pharmacy and get out as outpatient. Or after the coming back from the pharmacy, go to the doctor and get admitted, or coming as an emergency. These are all the sources by which the patients flow in. Every area we dissected the process and made sure that the patient waiting, patient attending, quality of what is being delivered, time consciously, patient friendly, and these were our core areas in which we concentrated. We always wanted a hospital of our size and magnitude. We need, even in Ahalya there in Abu Dhabi, we had so many people who were attending to patient hand-holding. So that was one. So patient experience improvement is one of the important strategies which we took for us to increase, number one. The second important strategy which was, as I told you already, we introduced lot of newer things. In fact, I want to tell you, we are the first hospital in this part of the country to introduce two-wheeler ambulance called as Vegam.
Yeah.
This was actually, we realize now the traffic is so much, we are not able to reach people. Then we started home care facility. Again, in a large way, our home care is doing extremely well now. In 1 year, we have seen around 3,200 patients in this last 1 year, having started in January last year, 17.
Lovely.
So that way, how can we be market leader? How can we start doing things which are not being concentrated by others? How can we be technical? In fact, as a second-tier hospital, we started robotic couple of years back. And let me tell you, we are now one of the top hospitals in the national level doing one of the most competitive robotic surgeries in this country.
Wow.
That is because we strategized that multiple users, multiple departments get involved in a very cost-effective way. That was our success. That way, as I told you, patient experience, lead in technicalities and giving the expert most. You should do something which others are not able to do. If others are doing, how cost effectively and more affordable way and more simpler. So this is the second which we. The third important thing, what I would say is, we have we keep auditing what we do. It's very, very important. Let it be the clinical services, or let it be the financials, let it be the quality work, whatever it is. We have a regular process of the performance reviews, the financial reviews, and make sure that we should know where we stand, where are we now, what is our target, and how do we go about it. So in that way, as a hospital, we have to keep on reassessing our performance, because it's like our driving. In driving, the front is what the road is ahead, but you have to keep seeing the rear view mirror, so that the rear view mirror helps you to see who is coming with you, who is behind you, at the same time who is trying to overtake you. Everything is seen in the rear. So we have to keep reassessing our performances. So these three, I would still call it as the most important things for us to stay afloat, to stay ahead, to be successful.
Thank you so much, sir. It was wonderful podcast. And to be a successful hospital administrator, they should follow the process. They stick to the process, the efficient process, patient experiences, the upgradation of infrastructure and correct pricing and proper workflow. These are the very important thing to be run a successful hospital. And in your busy schedule, you take your time, and from morning till now you spend time with us. Really, it will be a wonderful podcast and wonderful learning experience for watching this video. And really, you said that brainstorm before you start a hospital. So hope people who watching this video definitely help. Thank you so much for being with us. Thank you.
In fact, I also want to thank you, because as I was talking to you in between, this is a platform for people like me to share our, if I am permitted to say, share our wisdom, if we have it.
No, no, sir. You have it, sir.
What I try to say is, this is a platform in which, when you asked, because it's honestly an extempore, I never came prepared with any of the question, any of the answers for that matter. So what came to my mind was purely I spoke from my own experience, and I realized that this is a very good platform in which you have helped me to know what I know. So thank you, Santosh ji, and I thank all the teammates who have supported in this, and it's a fantastic experience for me. Thank you.
Thank you so much. Thank you so much for watching this video. And if you are a hospital owner, do subscribe and like our channel. Also forward this video to whomever required this video. Also, if you have some more questions, do put us. We get the answer from Dr. JSB sir and give it to you. Thank you so much.
Thank you.